Female genital mutilation, also known as FGM, is a form of gender-based violence comprising all procedures that involve the partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons.
According to UNICEF, an estimated 200 million girls and women are currently living with FGM, with a further 8,000 girls at risk every day. Around 3 million girls a year. According to the European Parliament, an estimated 500,000 women and girls in the EU have been subjected to FGM. About 20,000 women and girls from affected countries of origin seek asylum in the EU each year. United to End FGM is a multi-language web platform for professionals in contact with women and girls affected by FGM. UEFGM offers cost-free e-learning courses providing information and practical advice in 9 languages, country information on FGM covering 11 EU member states, interaction and networking through a discussion forum, live knowledge supporting online discussions, webinars and consultations among experts in the field.
The UEFGM web platform aims to provide easily accessible information and support to professionals dealing with FGM and increase the capacity of a range of experts across the EU to effectively provide assistance and protection to those affected by FGM.
UEFGM also aims to raise awareness by improving public knowledge and preventing stigmatization in the media, as well as serve as an EU-wide multilingual resource and education center on FGM.
All the girls I know avoid going to the doctor because they feel embarrassed having to explain everything repeatedly. The shock and the disbelief of professionals shows that they do not always understand FGM and its affected communities. Better skilled professionals can contribute to quality services for women and girls.
Ma première visite en Belgique chez un médecin a été traumatisante pour moi parce que le médecin il était étonné de voir une femme qui a subi des mutilations génitales féminines.
The UEFGM e-learning course addresses the issue of female genital mutilation in the context of health, asylum, police and law enforcement, community engagement, social services and child protection, access to justice, education, and media.
Le rôle des professionnels de santé est d'abord d'écouter sans juger pour que la femme soit en confiance et puisse parler de son excision. Soigner, prendre en charge les conséquences physiques et psychologiques, et puis aussi prévenir l'excision chez les petites filles en reconnaissant les signes de risque et en renforçant la capacité des parents à protéger leurs filles.
Where women and girls face a real risk of FGM and they constitute members of a particular social group and there's no state protection, they would definitely have grounds for asylum.
FGM is severely underreported. There are very few complaints of survivors of FGM to the police or the judicial authorities. This is mainly due, we think, to the taboo that exists around the practice and also due to the lack of knowledge of professionals.
Engaging with the communities and listening to the community leaders is very important in order to ensure the intervention programs of FGM to be effective and accepted by the community.
Sozialarbeiterinnen haben eine entscheidende Rolle im Schutz von gefährdeten Mädchen von FGM. Das Fachpersonal sollte sich voll darüber im Klaren sein, welche Verantwortung es hat und auch welche Pflichten zu handeln. Das bedeutet in allererster Linie, dass sie die relevante EU- und nationale Gesetzgebung zu FGM kennen und anzuwenden wissen. Das bedeutet, dass sie auch in der Lage sein müssen, das Risiko, in dem sich das individuelle Mädchen befindet, abzuschätzen und eine Entscheidung zu treffen, wie sie jetzt intervenieren sollen, immer das Interesse des Kindes als Leitgedanken zugrunde liegen.
The role of the justice system in fighting FGM is threefold: prosecution, prevention and protection. But three roles are interlinked. Prosecution has a strong preventive and dissuasive effect, and in that way could protect women and girls in the future.
It is important to adopt a whole school approach to tackling female genital mutilation because it provides a more comprehensive response, and this focuses on policies that address safeguarding and support teacher training on how to respond effectively.
There are many challenges when reporting on FGM in Europe. Media professionals need support through tailored training and tips to help them know how to report on FGM meaningfully and clearly.
Mes filles qui sont grandes aujourd'hui, qui ont 16 et 18 ans, commencent à prendre le relais. Elles en parlent autour d'elles, elles parlent des mutilations, elles expliquent comment elles ont été sauvées, elles expliquent mon parcours auprès de leurs copines et des familles de leurs copines. Donc chez moi, le relais il est vraiment assuré et j'en suis très fière.
Women and girls affected by FGM need the support of professionals who understand our needs as women and respect our culture.
Visit uefgm.org.